Welcome to the video on the role of occupational therapy in the recovery of a stroke survivor. I am Kirsten and I work at Life Vogels Hospital and at Balance Therapy Centre. Stroke is a life-altering event that affects many aspects of a patient. Not just the physical abilities, but also the cognition and the visual perception, which are all necessary to perform your daily tasks, such as dressing, cooking, fulfilling your role as a husband, as a wife, as an employee, or an active member of the community. Occupational therapists, or OTs in short, specialize in helping patients regain skills after a stroke to be able to fulfill their roles and to be able to perform daily tasks, like said with the dressing or cooking. As you have heard many times before in this series, every stroke is different, so is every journey of the rehabilitation. The survivor's recovery is influenced by many factors, such as the size and the area of the brain that the stroke occurred, as well as personal factors of the patient, such as the age and also his previous level of functioning before he suffered the stroke. As every journey is different for the recovery of a patient, so is the treatment plan and is then adjusted to the patient's needs. When the patient is admitted to the hospital after he suffered a stroke, he will be assessed by the occupational therapist to determine his level of functioning and being able to perform his daily tasks. We specialize on the function of the upper limb, the physical abilities of the hand and arm, which includes the movement, the sensation, the fine motor coordination, and dexterity. The therapy is started from day one after being admitted. First the assessment, and then the treatment plan is discussed with the family and the patient and designed according to the patient's needs. And the therapy then continues while in hospital, continues in further when the patient is transferred to a rehabilitation centre, and also after being discharged to home altogether. You might remember from the video from the physiotherapy about a patient suffering from hemiplegia. This means that there might be no movement or limited movement and no sensation of the limb opposite to the side of the body of where the stroke occurred in the brain. This means when the stroke was on the left side of the brain, the right side of the body will be affected. Therefore, therapy then is aimed at maintaining passive mobilization and passive movement, as well as active strengthening of the arm and the hand, because that is needed to perform your tasks. Occupational therapy then focuses on the fine motor skills and the dexterity to be able to engage in those basic daily tasks. But occupational therapy goes beyond just the physical components. Occupational therapists also address the cognition, which includes concentration, memory, processing speed, problem solving, just to name a few, as well as visual perception skills that are necessary to perform everyday tasks. Cognition and visual perception will be addressed further in a different video. Depending on the patient's needs, the occupational therapist will teach the patient adaptive and modified techniques to perform activities of daily living, also short ADLs, and also can introduce adaptive equipment or assistive devices such as wheelchairs, grab rails, toilet seats that are raised, and different things to help with every task, to help you perform activities in the kitchen, in the bathroom, and just increase your independence with functional tasks. These innovations empower independence for every patient. Another vital role of recovery, except for the cognitive and the physical components, is the emotional well-being. This is to include the patient in social interactions. In therapy, we empower the patient and encourage to practice their skills in real-life situations, such as going to the shops or to a restaurant, and then to train them to use their skills learned in therapy to be able to function normally in their roles. Additionally, occupational therapists will also encourage group therapy sessions, where patients can then meet other patients with similar challenges and that they can support each other as well. To conclude, occupational therapy encourages patients to gain independence in their daily tasks, with addressing their physical components, physical difficulties, then also with their cognition, visual perception, all to encourage the patient to fulfill their roles as an active member of the community and regain independence in normal daily life tasks. I hope this video helps to empower you with a bit more knowledge, how the process of rehab works, and to make the process of rehab easier.